Hello everyone, a very good evening to one and all of you. Today I will be taking the second part of pap smear reporting, and that is about the organisms that you can find in the pap smear. So I will be discussing it as case scenarios because I think it should be a little bit more practical in approach. So, like as we get in OPDs, site OPDs about the pap smear, so we will discuss it one by one. So first case, it's about a 30-year-old female who came with complaints of menorrhagia, this increased menstrual bleeding. And then in per vaginal examination, her cervix was normal and her fornices are free. And in the ultrasonography, it was suggestive of adenomyosis. Pap smear was taken and it is day 17 of menstrual cycle. So the patient is having menorrhagia and that is mostly because of adenomyosis, I guess. And as a routine, you take pap smear because that is how in Indian scenario we take pap smears because mostly for the screening for them to come at 25-year of age, it is like very less likely. So when we get patients to show the who come for the first time to the gynecopedy, we just take the pap smear. So the ideal time of taking pap smear is day 10 to day 20 of the menstrual cycle. Okay, day 9 or 10 to day 20 of the menstrual cycle. It's almost the mid part of it. So what are we seeing in this slide? So since the patient is day 17, this is a secretory phase. Okay. So it is important to check on the LMP and know ki which part or day of the menstrual cycle the patient is in. Okay. So that also says a lot about the clinical history is something which you have to narrow down and have a clinical scenario and in mind, and then you are going to look at the slide. Okay. So this is a patient with adenomyosis and menorrhagia. The menorrhagia is explained by the adenomyosis itself. So there is nothing very specific about the history that we have to be getting in the pap smear other than the fact that the patient is in secretory phase. So now what are we seeing? So we are seeing a lot of slender rod-shaped bacilli. So these are, as we all know, it is Dodderline bacilli or lactobacilli, which are the normal vaginal flora component. Okay, so these bacteria, along with that, you can see many intermediate cells, and then you can see occasional squamous superficial epithelial cells as well. Okay, so what phase are we seeing? It is secretory phase. So I had said in my last presentation that in secretory phase, we are going to see lot of lactobacillus proliferation along with intermediate cell proliferation, and there will be cytolysis. Okay, cell has undergone degeneration. So, or dissolution. The cytolysis has happened, and then you can see cytoplasmic fragments and so much of bare nuclei. Okay, you can see a lot of bare nuclei in the background and cytoplasmic fragments without any nucleus. So these are Dodderline bacilli that are 3 to 5 micrometer in length, and they maintain the acidic pH of the vagina. How do they maintain the acidic pH? Because they convert the glycogen that is present in the superficial squamous epithelial cells and the intermediate squamous epithelial cells to lactic acid. Okay, we know ki glycogen metabolism, we had studied in biochemistry that lactic acid is an end product of glycogen metabolism. So these bacilli convert the glycogen into lactic acid. And from where does this glycogen come? Okay, so glycogen comes from the storage that is there in intermediate cells and superficial squamous epithelial cells. In that also mainly it is in the intermediate cells. So what does the bacteria do? Glycogen is present inside the cytoplasm. You cannot go and access it fast. So what does this lactobacilli do is that they secrete enzymes to break down the cell membrane of the intermediate cells so that now they can access the glycogen and then they convert it into lactic acid. So while breaking down the cell membrane, there is cytolysis that is caused. So that is how we see in a secretory phase so much of intermediate cells, and they have undergone cytolysis, and then you see cytoplasmic fragments as well as the bare nuclei in the background and lot of lactobacilli. Why do we maintain an acidic pH for the vagina? Because it is protective against infections. Because during sexual intercourse, there is a chance of lot of breakage of the epithelium and infections to come into. So acidic pH gives a certain level of protection against these infections. So these Dordalin bacilli especially seen during secretory phase. Then we come to case number two. So in case number two, it is a 30-year-old female who came with complaints of foul smelling greenish vaginal discharge. Okay, foul smelling greenish vaginal discharge. It is a very characteristic kind of description. And then per vaginal examination shows strawberry cervix, and ultrasonography shows a 3 millimeter fibroid in the anterior wall of the uterus. Okay, so you can know the patient has been come for vaginal discharge, but she can have other gynecological complaints as well. It is important to look through everything, that sonography, per vaginal examination, and everything, so that it should correlate with our findings. And then pap smear was taken in day 10. Day 10, that means it is proliferative phase of the menstrual cycle. So greenish vaginal discharge and stormy cervix. Okay, you should be always a clinician also first before being a pathologist. You should know the clinical scenarios also very well. Classic description, classic complaint, most common complaint of symptoms, and the clinical findings that are characteristics. These are things which you should always remember before you go and see the slide itself. You should have some TDs inside the mind. So as we all know, you can see the organism that are pear shaped in the pap smear, and these are very classical exam slide also, I will tell, because examiners love showing trichomonas vaginalis. Okay, that is the answer. So foul smelling greenish yellowish discharge, strawberry cervix, these are classical symptoms. Maybe the patient will be coming with greenish discharge, but strawberry cervix, maybe not all gynecologists might write it. Okay, maybe like inflamed cervix or something they might write. So even if you see any vaginal discharge also, still you have to see for the trichomonas in the slide. Okay, so you can see pear-shaped organisms, and then along with trichomonas, you will see all 80 to 90 percentage associated with leptothrix according to the studies. Okay, so I have seen trichomonas in many pap smear, but I have not seen much of leptothrix associated with it. But then if you come to see thread-like structures or organisms which are seen along with trichomonas, I hope you people can understand the trichomonas that are seen here. Okay, so these are leptothrix and there is trichomonas. One thing you have to know is trichomonas size is almost equal to the size of the intermediate cell nuclei. Okay, so you can compare it with the intermediate cell nuclei and it's almost of the same size, then you can be sure that organism is trichomonas. If you are doubtful whether it is cytoplasmic fragment or not. So Trichomonas vaginalis, they are pear-shaped. They are flagellated organisms of size 15 to 30 micrometer square. Intermediate cell nuclei is of the size of 35 micrometer square. So in pap smear, measurement helps a lot to compare and understand whether there is abnormal or there is organism or many such things. So try to study or memorize the sizes, or at least the sizes you have to compare with. So trichomonas size is almost equal or comparable to the intermediate cell nuclei. Okay, here name it might be a little bit bigger. So these are cells which are like intermediate to parabasal. This is an intermediate cell. So you can see the nucleus is almost same to the trichomonas. And then you will see pale eccentrically placed vesicular nuclei. Okay, these nuclei are eccentrically placed. They are vesicular. And then you will see eosinophilic cytoplasmic granules. Okay, so eosinophilic cytoplasmic granules, which are more prominently seen in liquid-based cytology than conventional smear. So why is that characteristic that I mentioned is because it is used to differentiate trichomonas from cytoplasmic fragments. As I said, in secretory phase, because of the cytolysis by the lactobacilli, you can see many cytoplasmic fragments and bare nuclei. So these cytoplasmic fragments are also like this small. So to differentiate it, you can see there is cytoplasmic granules in trichomonas, but it won't be seen in the cytoplasmic fragments due to cytolysis. Other thing you can see flagella, which is better seen in liquid-based cytology, and then there are mature squamous cells with perinuclear halos. Okay, see, you can see a very clear perinuclear halo that is very regular. Okay, this is a this I also mentioned it in reactive cellular change in the pap smear. So it is reactive or in infection and inflammation. Also, you can get this perinuclear halo that is also seen in trichomonas, and you will see characteristic polyballs. Okay, I'll show the picture of polyballs. Polyballs are balls of neutrophils that have been grouped together. It is also a characteristic of trichomonas clinging to the epithelial cells also. So you can see the trichomonas that are clinging to the epithelial cells also. So these are the features of trichomonas. So this slide shows the feature of clinging of the trichomonads on the intermediate epithelial cell. And then here you can see the polyballs or the neutrophilic aggregates that form in the smear, okay, which is again a clue for trichomonas. And in LBC slide, you may be seeing the pear-shaped organism and the flagella very properly, and then you can see the granules present in the cytoplasm of the trichomonas. Okay, so these clues also you should remember, like polyballs, clinging of the organism to the epithelial cells, etc. See, it's different for every pathologist. They note the different characteristic features, okay, of a cell or an organism or a disease also in particular. See, if I am seeing an eosinophil in a slide, I pick up first the reddish granules. Okay, that is what comes into my viewpoint, or my eyes catch that point very fast. But for others, it might be a bilobed nucleus or the speaker shaped nucleus. Okay. And for others, it might be even the size of the cell also. So there are different things that different people note. Okay, so this is the same for pathologist also. So if a person is walking into a room, maybe I note at the um, dressing style. Okay, there may be some people which look at the shoes. There will be some people who look at the makeup of the person. Some people look at the hairstyle. Okay, so it is different for different people. So for you also, you should find what is your niche. Okay, or uh, what is your point that you catch in the slide? For me also trichomonas, it's at times it is difficult. Okay, so in this slide, see, this is trichomonas, this is trichomonas, this is trichomonas. Okay, so at times it is little bit difficult also to find a trichomonas. I might say, I frankly admit that my pages are sometimes better in finding trichomonas than myself. But what I check is that if there is a history of discharge, vaginal discharge, and then you can see this polyballs, marked inflammation, and the granular background, which is suggestive of discharge again. And then you check for the trichomonas in the smear, then you will get it. Okay. So, but some people, even if without telling all these things, they easily catch up trichomonas also. So that differentiating feature, all the things that catch your eyes are different. So you should find which is the feature you catch up very fast. Okay. And then it is a very common exam slide. If people tend to keep pap smear in for examination, you should check for that trichomonas is not there, because many examiners it is a favorite slide, and other parasites also especially. So trichomonas, as you can see, they are flagellated organisms. They have flagella. They have a nucleus which is eccentrically located. They have a pear-shaped body. There is an axostyle, and then there is cytoplasmic granules also. So sometimes when there is groups of trichomonas together, it is called trick parties. Okay. A funny term, trick parties. And then when leptothrix is found along with trichomonas, it is called spaghetti and meatball appearance. Okay, so the spaghetti is obviously the leptothrix, and the meatball is the trichomonas. Though I don't like comparing such organisms and pathological findings to food items. I don't know, some people are obsessed with such things like strawberry cervix, anchovy sauce, pus for the amoebic pus. I guess people who think about food all the time. Anyways, so these are things which we also have to remember. And then see, this is in electron microscopy how you're going to see the Trichomonas vaginalis. As you can see, it's a pear-shaped organism with the flagella. You can see the axostyle or the undulating membrane. And this is Trichomonas, which is an amoeboid form where it is sticking to the vaginal epithelial cell. I found this picture very interesting so that you don't sleep in between. I just put some interesting pictures also. I do this during my classes. Okay, so coming to leptothrix, a small word, it is a gram-positive anaerobic road, and you can see these filamentous forms. These are with occasional branching, you can see, and then they have clear discharge, usually not very greenish, like kind of, which is of trichomonas, and they are usually seen associated with trichomoniasis. And then the third case is a 30-year-old female who is complaining about a white, curdy vaginal discharge. Okay, very characteristic, white, curdy vaginal discharge, a very common infection. Cervix is inflamed and USG is suggestive of ovarian cyst of 5 into 4 centimeter. Okay, so this case, why I wanted to show is that maybe the patient also is a follow-up case of ovarian cyst, and then many a times it is found that the patient came for other complaints, and then you examine for the patient, and then you are seeing this white patch over the vulva and the vagina. And then when you ask, the patient is having vaginal discharge also. Okay, and the pap smear was taken on day 12, which corresponds to almost proliferative to ovulation time. And then you are seeing this beautiful shish kebab effect in the liquid base cytology, and then you are seeing these small yeast forms and pseudo hyphae forms. So this is the common infection of candidiasis. Okay, so candida species, you can see it as budding yeast and with or without pseudo hyphae. So they are eosinophilic to gray brown color, and these pseudo hyphae, they are cytoplasmic extensions of the budding yeast. Okay, so these budding yeast itself, when the budding part is extending so much, it feels like a hyphae. So that is why it is called pseudo hyphae. And because of that, because it is a cytoplasmic extension, it doesn't have septations. But they have constrictions that indicate it is a new cell formation. That is, it is extending and then it is constricting also at the end, because it is a budding cell, right? So it is budding from the other ends. And then you can see fragmented neutrophils and squamous epithelial cells are speared by the pseudohyphae, which is called the shish kebab effect, which you see especially in the liquid-based cytology slides. And at times you can see the budding yeast forms is surrounded by clear halos, these clear halos, but then there is no pseudohyphae. Okay, so such kind of candida is seen in candida glabrata infection. Okay, that is, you can see budding yeast forms with halos, but there won't be any pseudohyphae. So next we will come to the fourth case, that is 30-year-old female who is coming to the OPD with complaints of fishy, foul-smelling vaginal discharge. Okay, it is also very characteristic. There is pruritus, abdominal pain, and the patient is ongoing treatment for PID. Okay, that is pelvic inflammatory disease. Cervix is inflamed in per vaginal examination or speculum examination, and sonography is normal. Pap smear was taken in day 18. So day 18, that means it is a secretory phase. So what are we seeing? These are the characteristic clue cells. Okay. So clue cells are seen in, as we all know, it is bacterial vaginosis. Okay. So bacterial vaginosis is also a common diagnosis that we give in pap smear when we get such clue cells. So the individual squamous cells are covered by a layer of coco bacilli, and you can see the coco bacilli in the background also. The background is clean or filmy, we say. Filmy means there is only the coco bacilli, but there is no inflammation usually. And these clue cells, when do we call it as clue cells, is that it can be covered by discharge fully, the squamous cells. But then the discharge contains bacteria also. But when the cell membrane is fully obscured by the bacteria, that is when you call it as the clue cell. Okay, the cell membrane is fully obscured by the bacteria. Then we call it clue cell. And then maybe you can see the conspicuous absence of lactobacilli because of the abundant proliferation of the cocobacilli. There is no lactobacilli. And then if there is inflammation, then you call it vaginitis. Okay. So usually there shouldn't be any inflammation or there is no inflammation. That is when you exactly call it as bacterial vaginosis. If there is inflammation, then you call it vaginitis. Okay. And that also we give it as shift in flora suggestive of bacterial vaginosis. So in pap smear, we are going to report shift in flora suggestive of bacterial vaginosis. So what are these cocobacilli? They are Gardnerella vaginalis, Peptostreptococcus, bacteroids, and Mobiluncus. Okay, Peptostreptococcus, I forgot to put a capital P. Sorry. So all the names you have to put capital letter. Okay, so it is like respecting a living organism, even if it is a bacteria. So, anyways, what I'm trying to tell is that these are the bacteria which also cause pelvic inflammatory disease for a female patient. So, usually these bacterial vaginosis patient is associated with abdominal pain and all, then you should check whether there is pelvic inflammatory disease history. Okay. So, these are the organisms that cause pelvic inflammatory disease. So, when there is clue cells and when there is abundant inflammation, their cervix also, then you should call it vaginitis. Okay. And then in the next case, it is a 30-year-old female who complains of vaginal discharge and pruritus. Note down that the patient has history of IUD insertion. Okay, intrauterine device insertion, very notorious infection that is associated with IUD. And pap smear was taken in the 10th menstrual cycle. So what do you see? First, when I saw this photo, also I was like a little bit taken aback because it is looking like a tarantula spider. You know, if you have seen the spider in Google Images, you can see. I have not seen the spider actually. Also, I'm a little bit arachnophobic. Anyway, so what are these organisms? These filamentous structures, woolly structures that are arising from it. Okay, it's not anyway a big spider or something. It is actinomyces. So actinomyces is very notorious to be associated with IUD, and then they have tangled clumps of filamentous uh, organisms they are, and they have acute angle branching as you have seen in the tentacles of the spider-like thing. And then you will have cotton ball clusters if you are seeing these things in the low power. And the radial distribution of the filaments with woolly kind of appearance they have, and there will be masses of leukocytes that can be seen at the end to these woolly kind of thing. Okay, or cotton ball kind of thing. And then obviously you will get a neutrophilic inflammation. So you can see there is so much of neutrophilic inflammation, and this is in low power. You can see these cotton ball like kind of appearances. And this is an aggregate of lactobacilli. Okay, so this you should not get confused with the actinomyces infection, because here you might think there is filaments and all, but these, if you see in the background, there are so much of lactobacilli here and there, and if you see these are individual lactobacilli only. So this is just an aggregate of lactobacilli. It is not actinomyces. So that much about actinomyces, which is not very common to see in pap smear. If you have an IUD history, then you should specially look for it. And then 30-year-old female who has come with complaints of pruritus and redness in the vulva. And then there is vesicles present in the vulval region. Very notorious infection to cause vesicles over the skin. Okay. And then USG abdomen is normal. Day 13 of menstrual cycle, almost ovulation day, that is between proliferation and secretory phase. So what are we seeing? So these are cytopathic effect of herpes simplex virus. So that is ground glass appearance of the nuclei. Okay, so herpes simplex virus causes cowdry A-type nuclear inclusions, that are intranuclear eosinophilic inclusions. So the nucleus in that you will get something like owli. You don't call it owli, but you will see eosinophilic nuclear inclusion, and outside that there is a halo, and then there is a nuclear membrane. Okay, so you will get these ground glass appearances in the nuclei, and due to accumulation of viral particles it is giving this ground glass appearance. And then margination of the chromatin. Margination means you can see the chromatin is almost only in the membrane part and the central part is fully clear. So this is called margination of the chromatin. So 3 M's are, it is the famous 3 M's that we get in herpes simplex virus, that is multinucleation you will see of the endocervical cells or histiocytes, and then there will be molding and then margination of the chromatin. Molding means these nucleus are multinucleated as well, and they show molding, that is they are arranged as a pavement of tiles. Okay, so 3 M's are multinucleation, molding, and then margination of the chromatin. So that is all what you have to know about herpes simplex virus. So next we come to a case where there is 30-year-old female with complaints of vaginal discharge and pruritus again. And then you are seeing this. Okay. So which organism are you finding in this? You can see there is in background there is some kind of lactobacilli and all. Okay. The thing to be noted is you can see inflammatory perinuclear halo as well. You can see nuclear grew very beautifully. These are intermediate cell nuclei. But then coming to these cells are also having almost intermediate to parabasal kind of cells. But you can see there is the perinuclear halo is very irregular, and then compared to these nuclei, they are showing nuclear enlargement as well. So what is this? This is a slide of L cell. Okay, even if we give escas also fine, but L cell is something which you have to at least diagnose in this slide. So what I am trying to tell is that if there is a case of vaginal discharge or anything that is a scenario of infection alone, it is not that you're putting the slide to see only for trichomonas or candidiasis or anything. What is the purpose of pap smear? Pap smear is done to find out that there is squamous cell carcinoma or squamous intraepithelial lesion or not. Okay, so pap smear is for cervical cancer screening. So whatever organism is there or not, if you report, it is well and good for you. It may be helpful for the diagnosis for the clinician or the gynecologist. But if you miss squamous intraepithelial lesion, it is a much more of a crime than missing a trichomonas in the slide. Okay. Anyway, for this greenish discharge and whitish discharge, and the clinician itself will be knowing trichomonas and curdy discharges, candidiasis, and they might have been started with treatment even we if before we are giving the diagnosis. So we can support them in that way, but even if the patient is coming for infection or any other thing, it's very important that you screen the slide fully for squamous intraepithelial lesion or carcinoma. So you have to keep it in mind that you are doing pap smear for screening of cervical cancer or any squamous intraepithelial lesion, or maybe even atypical glandular cells also you have to look for. So it's important to know the normal cells, and then you have to know the atypical cells, and then you have to know for organism. So looking for the organism, you should not miss squamous intraepithelial lesions. That is what I want to say. So to make it much more interesting to know whether you people have understood or studied from this something, I have put a fill in the blanks. If people who are curious enough, you can take 3 to 5 minutes, take a pause in this lecture, and then you can answer these questions and assess yourself whether you have found out or you have learned very properly. And then after that, you can see the answers and see how much you yourself have scored. Okay. This is something which I have started putting now in the PPT so that it can be much more productive, or people will be listening more, so that it will be interesting So fill in the blanks. The first question is clue cells are seen in, IUD insertion is associated with, then polyballs are seen in, shish kebab effect is seen in, ground glass appearance of nuclei is seen in, cotton ball clusters are seen in, normal vaginal pH is dash and due to dash, and then spaghetti and meatball appearance is seen due to dash and dash. Okay, 10 marks here. I have given 2 marks. And then budding cells with clear halo and no pseudo hyphae is seen in. This is a little bit tough questions. For every exam, you will have some tough questions. So if you have written, I'll go to the answers. So clue cells are seen in bacterial vaginosis. IUD insertion is associated with actinomyces infection. Polyballs are seen in trichomoniasis. Shish kebab effect is seen in candidiasis. Ground glass appearance of nuclei is seen in herpes simplex virus infection. Cotton ball clusters are seen in actinomyces infection. Normal vaginal pH is acidic and it is caused due to Dordaline bacilli or lactobacilli. Spaghetti and meatball appearance is seen due to Trichomonas vaginalis and Leptothrix. Budding cells with clear halo and no pseudohyphae is seen in Candida glabrata. So we are almost coming to the end of this presentation. So the homework for you is to identify this organism which you are seeing here. It is called a characteristic owl eye appearance. And this is a photo from Bethesda. So you people can comment on what the organism is, or you can go back to Bethesda and then read about the organism. So if you have liked the video, kindly like, share and subscribe my channel, and then comment about your doubts or any questions. And if you want me to discuss any topics, you can put it in the comment itself. Okay. So thank you so much for listening. Kindly do support my channel.